No more pneumonia. Pneumonia is an inflammation of the lungs, which can be caused by various reasons, such as pathogenic microorganisms, physical and chemical factors, immune damage, allergies, and drugs. The most common one is alveolar inflammation, but the terminal airways and pulmonary interstitium also may cause inflammation alone or in combination. Pneumonia can be roughly divided into two categories: infectious pneumonia, and non-infectious pneumonitis. Common symptoms of pneumonia include a productive cough, chest pain, fever and difficulty breathing. Symptoms may range from mild to severe. Especially the elderly or newborns may experience atypical symptoms. Gradual improvement usually occurs within 3 days of starting treatment. However, patients may experience fatigue for more than a month in the future. Symptoms of infectious pneumonia include cough, fever and chills, difficulty breathing, chest pain when taking deep breaths, and a high respiratory rate. The most obvious symptoms in older people are confusion, mental changes, or confusion. Typical symptoms in children under 5 are fever, cough and difficulty breathing. Symptoms in children younger than 5 years old include fever, cough, difficulty breathing or rapid breathing. But fever is not just a symptom of pneumonia. It is a common symptom of many diseases and may not appear in cases of severe illness or malnutrition. Children less than 2 months old will generally not have coughing symptoms if they get pneumonia. Other more serious symptoms in children include blue skin, not wanting to drink, convulsions, persistent vomiting, high fever or decreased level of consciousness. Bacterial and viral pneumonia usually have similar symptoms. Some pathogens that cause pneumonia often produce some non-specific symptoms, but patients with these symptoms cannot be diagnosed as being caused by the pathogen. For example, pneumonia caused by Legionella may be accompanied by abdominal pain, diarrhea, or confusion. Pneumonia caused by Streptococcus pneumoniae may have rust-colored sputum, and pneumonia caused by Klebsiella pneumoniae may produce a black, like sputum. Gooseberry jelly, bloody phlegm. However, bloody sputum is not a unique symptom of pneumonia. Tuberculosis, gram-negative bacterial pneumonia, lung abscess, and acute bronchitis can all occur. Mycoplasma pneumonia may be associated with cervical lymphadenopathy, arthralgia, or otitis media. Shortness of breath occurs more often with viral pneumonia than with bacterial pneumonia. Pneumonia is usually caused by a viral or bacterial infection, and occasionally by other microorganisms. In addition, the effects of drugs or autoimmune diseases can also cause pneumonia. Risk factors include lung diseases such as cystic fibrosis and chronic obstructive pulmonary disease, as well as asthma, diabetes, heart failure, a history of smoking, stroke that impairs the ability to cough, and immunosuppression. Pneumonia is often diagnosed based on symptoms and physical examination. Chest X-rays, blood tests, and sputum microbiological cultures can all help confirm the diagnosis. The disease can be classified as community, hospital, or healthcare-associated pneumonia depending on the location of infection. Vaccines are available to protect against certain types of pneumonia, and other prevention options include washing hands and not smoking. Treatment depends on the underlying cause of the disease. Antibiotics are used to treat pneumonia caused by bacteria, and if the patient becomes seriously ill, he or she is usually hospitalized. Oxygen therapy is used when a patient's oxygen levels are low. Approximately 450 million people, 7% of the global population, suffer from pneumonia every year, and approximately 4 million people die from it every year. Pneumonia was considered the master of death by the 19th century physician William Owsley. In the 20th century, the invention of antibodies and vaccines led to improvements in survival rates. However, among residents of developing countries, the elderly, young, and patients with chronic diseases, pneumonia remains one of the leading causes of death. Because pneumonia often shortens the suffering of dying people, it is called the old man's friend.